The Caribbean Med Labs Foundation, CMLF, has been engaged in a consultancy under the OECS World Bank Regional Health Project to support the implementation of national laboratory policies and legislation that underpin laboratory standards implementation in 4 OECS project countries. Lab policies and legislation will, we expect, positively impact the quality of healthcare provided within project countries as well as within the wider OECS and Caribbean region. CMLF has coordinated the development of a campaign to trust every result provided by medical and public health laboratories in the OECS, which the Prime Minister of St. Vincent and the Grenadines, the Honorable Dr. Ralph Gonsalves, has kindly consented to champion. The global context. It is important to place this initiative in both a global and a Caribbean context. Governments worldwide are increasingly regulating medical and public health laboratories to safeguard their populations from harmful lab practices. Over the past decade, lab services around the world have been undergoing significant reform and transformation. It is imperative that governments take the lead in introducing standards and laws to regulate medical and public health labs comprehensively. Despite the drafting and introduction of lab policies and laws and regulations to CARICOM countries over 7 years ago, approval and implementation have yet to occur. The pace of transformation in the Caribbean must accelerate, given the escalating frequency of natural disasters and the growing threat of epidemics. Our objective should be to establish laboratory regulation as the standard in the Caribbean, ensuring the trustworthiness of every test result. In 2022, the St. Vincent and the Grenadines government took a pioneering role in the OECS laboratory transformation by introducing the National Laboratory Policy and enacting legislation to regulate medical labs. These measures aim to enhance pandemic response, protect the population, and reduce healthcare costs. An urgent plea exists for other Caribbean heads of government to prioritize the highest level of healthcare for their citizens. It is estimated that over 80% of clinical decisions hinge on lab results. Only governments can guarantee that their populations consistently receive accurate lab results, guiding treatment decisions and curbing national healthcare expenses. Pandemics have a potential to cripple a country's healthcare system and devastate national economies, as we've seen with COVID. They've also severely impacted the region's tourism industry. The early identification of dangerous disease outbreaks depends on timely and accurate lab results. Only governments can prevent the collapse of the lab sector when confronted with the pressure of devastating pandemics and epidemics by establishing policies, guidelines, structures, laws, and resources for readiness. Non-communicable diseases pose a significant public health threat and contribute to healthcare inflation, consuming substantial national resources. Lab data and information are indispensable in NCD prevention, in control effects and cost reduction. Implementing laws to ensure reliable and accurate tests and the management of public health threats is essential. Regulated labs safeguard the Caribbean tourism industry and they enhance the sustainability of national health insurance programs. In the current global climate, global health security is a paramount concern, necessitating again the regulation of lab services to protect national, regional, and global health security. The presence of both anecdotal and concrete evidence of medico-legal issues, including the impact of lab errors, is a global reality that underscores the urgent need for lab regulation. Inaccurate lab information can have detrimental consequences on individuals' lives and expose governments to legal liabilities.